Hello, and welcome back to Pharmacist Michael's Happy, Healthy Living. Today, we're discussing a very important topic: 3 misconceptions surrounding schizophrenia. Let's clear the air and illuminate this often misunderstood condition. Some of you know I'm a board-certified psychiatric pharmacist, and I've spent many years in hospitals with mental health patients. And I can tell you that what a lot of us think about schizophrenia and psychosis is not real. What you see in the movies isn't always the truth.
Welcome to Pharmacist Michael's Happy, Healthy Living channel, where you will learn how to improve your life, one video at a time.
One of the most common misconceptions is that schizophrenia means split personality. This misunderstanding likely stems from the Greek roots of the word schizophrenia, which means split and mind. But the split refers to split from reality, or what we call a psychotic break, not to multiple personalities. In reality, schizophrenia is a complex brain disorder impacting the way a person thinks, feels, and behaves. It primarily involves psychosis, which can include delusions, which are firm beliefs in things that are not real, and hallucinations, which is seeing or hearing things that aren't there. It can also lead to disorganized thinking, where connecting thoughts logically becomes difficult. People with schizophrenia might seem like they have a split personality because their thoughts and emotions can seem disconnected from reality, and this can profoundly affect their behavior. But this is very different from dissociative identity disorder, or DID, formerly known as multiple personality disorder, where a person's identity is fragmented into 2 or more distinct personality states. Understanding schizophrenia as a spectrum of symptoms, rather than a simple split in personality, helps in recognizing the depth of the disorder and the challenges faced by those who experience it. It affects their ability to discern reality, manage emotions, make decisions, and relate to others. By clarifying this misconception, we can better understand the needs of those with schizophrenia and provide more accurate support and compassion. Recognizing the true nature of schizophrenia is crucial in advocating for and providing the right treatment and reducing the stigma associated with this condition. Myth number 2 is that individuals with schizophrenia are dangerous or violent. Thanks, Hollywood. This stereotype is perpetuated by media and a lack of understanding. In reality, where there are cases of violence, it is not a defining characteristic of the disorder. People with schizophrenia are far more likely to be victims of violence than perpetrators. They are often more vulnerable in society due to their condition. Several factors can influence behavior. It's important to note that most individuals with schizophrenia live regular, peaceful lives like anyone else. Their behavior is a complex interplay of many factors, including personal history, environment, and whether they receive appropriate treatment and support. The portrayal of violence in schizophrenia also overlooks the wide spectrum of symptoms and experiences of those with the condition. Schizophrenia can involve delusions or hallucinations, but these do not inherently lead to violence. Misunderstanding and fear can arise from observing someone experiencing these symptoms without comprehending their context. By perpetuating this myth, we do a disservice to those who live with schizophrenia. They face not only their personal challenges, but also societal ones: discrimination, fear, and misunderstanding. It's our responsibility to look beyond the myths and understand the true nature of schizophrenia. With proper care, including medication, therapy, and community support, individuals with schizophrenia can lead safe, productive, and fulfilling lives. The third misconception is that schizophrenia is caused by bad parenting. A pervasive myth is that schizophrenia is directly caused by bad parenting or a flawed family environment. This belief not only oversimplifies the condition, but also unfairly blames families for a complex medical issue. It's crucial to dispel this myth and look at what research tells us about the causes of schizophrenia. Modern science shows that schizophrenia is primarily influenced by genetics and brain chemistry. Studies indicate that certain genes can increase the risk of developing schizophrenia, but it's not determined by a single gene. Instead, it's thought to be caused by a complex interplay of genetic predispositions and other factors. The role of brain chemistry is also critical. Imbalances in neurotransmitters like dopamine and glutamate are believed to play a significant role in schizophrenia. These chemical imbalances can affect how the brain reacts to stimuli and processes information, leading to the symptoms experienced by those with the condition. While genetics and brain chemistry are significant factors, the environment has a role. Stressful life events, prenatal stress, or viral infections can trigger or exacerbate the condition in some already genetically predisposed. This is far from the outdated notion that family stress or bad parenting is to blame. Understanding the multifactorial nature of schizophrenia helps in addressing the condition more effectively. It requires a comprehensive approach, including medication, therapy, and support systems. Blaming parents not only lacks scientific basis, but also adds to the stigma and distress for families trying to support a loved one with schizophrenia. By acknowledging the real causes of schizophrenia, we can foster empathy and support for individuals and families affected by it. Educating ourselves and others about these complexities is a step forward in removing the stigma and promoting better mental health care. Please remember that schizophrenia is a complex and deeply individual experience. Each person with this condition has a unique journey with distinct challenges and needs. It's not just a clinical term. It's a part of many people's lives, affecting them and their friends and families. In learning and talking about schizophrenia, let's approach it with empathy, openness, and a commitment to understanding. Misconceptions can create barriers, but this video is a step towards dismantling these and fostering a more informed and compassionate society. I encourage you to continue this conversation beyond our video. Talk about what you've learned with friends and family. Support mental health initiatives in your community or offer kindness to those around you. Every action counts in building a more supportive environment for everyone. If you found this video helpful, please like and subscribe for more content. Your support helps in spreading awareness and breaking down the stigma surrounding mental health. Together, with each video, conversation, and active support, we can promote a deeper understanding and create a world that's more accepting and supportive for individuals with schizophrenia and other mental health conditions. My name is Pharmacist Michael. Be happy and be healthy.